So welcome everyone to the launch of Hello Type 1 in Myanmar. Hello Type 1 is a groundbreaking online education program for type 1 diabetes in Burmese. We are proud to have the support and endorsement from organizations leading in the front line of diabetes care worldwide and in Myanmar, which include ISPAD, the International Society for Pediatric and Adolescent Diabetes, MSEM, the Myanmar Society of Endocrine and Metabolism, with special thanks to Professor Coco, our guest speaker today, and Professor Mo Win Ong, who has been such strong supporters, and also our founding sponsor, Eli Lilly. All right, so here it's today's agenda. We have the great pleasure to have Professor May, OBE and trustee and volunteer chief medical advisor for A4D, pediatric endocrinologist in the UK, will give an introduction about the key actions of A4D, our effort in the research and publication field, and she will share about the key milestone of Hello Type 1. Then it's an honor for us to have Professor Coco, Professor and Head of Department of Endocrine and Metabolism, University of Medicine 2 in Yangon, and also President, of course, of MSEM. He will talk about the diabetes landscape in Myanmar. Following this, for the first time, we will have the chance to have Professor Mintnila, Professor and Head of Department of Pediatrics at the University of Medicine in Dongji. Professor Mintnila will refocus this event on type 1 diabetes and will talk about the way of type 1 diabetes mellitus in Myanmar. Then finally, I will introduce the Hello Type 1 program and show you live with a live demonstration before concluding with an open discussion. All right, so Professor May, this is a very great honor to have our dear Professor May. Professor May is not only OBE, our trustee, our volunteer chief advisor for A4D, but also pediatric endocrinologist, honorary professor at Edgehill University, and associate professor at University of Liverpool in the UK. So Professor May, the floor is yours.
Thank you so much, AC, and thank you to all the audience, all of you who are joining us this late evening in Myanmar, and from some of us in the UK and Europe and Southeast Asia. This is an honor to be launching our Hello Type 1 program, which is part of our Action for Diabetes charity education arm. As you can see from the slide, it's a very special launch, actually, because I want you to look at the very small orange phase 1. In 2015, Action for Diabetes had its first operational site in Yangon from the brainchilds of two of our founders who are present today, Charles Toomey and Jerry Gore. And over the next 9 years, you can see that we are now operational in 6 countries across Southeast Asia, across 34 sites. And Action for Diabetes is the only charity that is currently providing comprehensive diabetes care and treatment in Southeast Asia, supporting almost 1,000 children and young people. The Lancet Commission in 2020 estimated that approximately 20,000 individuals with type 1 diabetes died annually globally, with a total prevalence of almost 2 million in the world. We are still not yet closing the gap in resource-limited countries, with particular care noted in treatment of type 1 diabetes, education in type 1 diabetes, and its peer support. Action for Diabetes is committed with several programs. As you can see that one of our charitable ethos is that we guarantee ongoing supplies of free insulin, free blood glucose meter supplies and strips, HbA1c tests in hospitals and hospital emergency funds for anyone that we support from 0 to 25 years in Southeast Asia. Next slide, please. Action for Diabetes since 2015, from its first operational site in Yangon, now runs 34 sites across these 6 countries. And within these sites, we continue to track and monitor the health outcomes of all the children and young people that are supported. We're very pleased in recent times that we will start our operations in Philippines this year, and we have started this in its pilot sites. And we also aim to start our operations in Indonesia next year. Next slide, please. As you can see, Action for Diabetes have several arms. The Clinic Support Program arm is providing essential diabetes care and treatment, such as what I've earlier related to: insulin, blood glucose monitoring, HbA1c testing in hospitals, and of course, hospital emergency treatment for the children and young people. We also have the Diabetes Family Camps, which has been running for all these years, and these are run within all the countries in local languages as well as in English. And these are really important to maintain education amongst families and people living with type 1 diabetes, provide peer-to-peer support, and also enhance education within healthcare professionals. We have the Aspire arm as well, which provides a scholarship program for training, development, and education for our young adults in these countries. And health capacity building, we work alongside healthcare professionals in all these countries to ensure and maintain education and professional development. And especially today, we are launching Hello Type 1. This is a novel online digital educational program run in its native local languages within these hospitals. Next slide, please. On our Action for Diabetes website, you can see that in the past years, we have published over 20 publications related to our Action for Diabetes work, and we work alongside healthcare professionals to ensure that data regarding health outcomes, type 1 diabetes prevalence, particularly within Southeast Asia, continues to be published. Interestingly, the Lancet Commission in 2020 did not mention any research available in Southeast Asia. There was no data on type 1 diabetes incidence, prevalence, or health outcomes in Southeast Asia. We know that there is minimal health outcomes and data monitoring in this region, and we are committed to ensure that we continue to monitor this and eventually publish Southeast Asian type 1 diabetes outcomes. So please feel free. All these papers are open access and available to download from our Action for Diabetes website. And my last slide, please. Here you can see that Hello Type 1 is an award-winning program. It won the Innovation Prize from the International Society of Pediatric Diabetes Society in 2022. And we first launched Hello Type 1, which is the novel digital education program with 2 arms. The first arm is for families and young people and children with type 1 diabetes, having the dedicated website platform and the Facebook platform. And this was launched in Cambodia in Khmer, the language of its native country. We then launched Hello Type 1 in Vietnam in March 2022. So you follow along the road. And all these had its support from the societies within the countries and Ministry of Health, and memorandums of understanding was signed. In November 2022, we launched Hello Type 1 in Thailand, similarly with the support of the government and the societies. And we then presented Hello Type 1 at ISPAD and SP, European Society of Pediatric Endocrinology and International Society of Pediatric, Adolescent and Diabetes in 2022, the first analytics of the Hello Type 1 from these countries. Again, this paper is free to download to read from our website. Then fantastically, we got the Innovation Prize from ISPAD, which one of our founders, Jerry Gore, accepted it graciously in Dubai in October 2022. And we published our Hello Type 1 in BMC Endocrine Disorders Journal in 2023. In May 2023, we also launched Hello Type 1 in Bahasa, Malaysia, in Malaysia, again with memorandums of understanding signed by MES, MDES, UMMC, and endorsement from the Ministry of Health. In September 2023, one of your fellow countrymen, Sonini, who is from Myanmar, won a full scholarship to undertake and read his PhD degree at Edge Hill University, which I'm currently supervising. I'm not sure if Sonini is in the audience, but he is making remarkable progress. And his PhD work in the UK, full scholarship, is to undertake the impact of Hello Type 1 amongst the population with type 1 diabetes and amongst healthcare professionals as well. We'll be presenting our second Hello Type 1 abstract accepted to ATTD Asia in Singapore in November of this year, which I hope to attend. And of course, we come to today, August 2024, where we now launch Hello Type 1 in Myanmar. And this is a fantastic roadmap of the Hello Type 1 program. And we hope to see a lot of collaborations from this and further publications from this program. So once again, I thank you very much for attending at such a late part of your day. Thank you to Prof. Coco, Prof. Nila for endorsing, supporting this fantastic program. And we look forward to future collaborations. So hopefully this is a snapshot of the Action for Diabetes charitable work and the Hello Type 1 award-winning program. Thank you very much.
Thank you, Professor May. Thank you very much. Now, I would like to welcome Professor Coco, dearest president of MSEM and professor and head of Department of Endocrine and Metabolism at the University of Medicine II in Yangon. And he was such a great supporter of Action for Diabetes since the beginning of our operations in Myanmar. And we are very, very grateful for your help, Professor Coco. And I would like to take also this occasion to thank Professor Mo Vin Ong for her commitment and dedication to our cause. So, Professor Coco, I will now show your slides. The floor is yours.
Thank you, AC. Thank you very much. And good evening, everyone. Greeting from Myanmar. And I'm very much honored to be part of the participant or speaker for the Dash Auspicious and evening for the launching of the Hello Type 1 program in the Myanmar. So my task today is to talk about the NCD and diabetes landscape in the Myanmar. So next slide, please. So Myanmar is population of 54 million. This is a data from the 2019. There's an epidemiological transition taking place in the country, the same as regional and global trend. Is coming from the communicable disease to non-communicable disease. So according to the STEP survey 2014, 94% of the adults live with at least one risk factor of the NCD in Myanmar now. And then 68% of the death is due to NCDs, according to data on the WHO 2017. So next slide, please. So this is a burden of the NCD in Myanmar. So population is just like 54 million. So in total death in 2016, you just like 430,000. And among them, NCD death is 68% of the all deaths. You can see the proportion of mortality here. CVD is the most top of the list, 25%. Cancer is 13%, CRD 8%, diabetes 4%, but I can see this is the hidden because most of the cases are related to diabetes. If say supposing if the patients die with the ischemic heart disease, the underlying also has a diabetes, and they also have a problem with this cancer patient die with the diabetes. They also have a diabetes as well. So these are the hidden cause of the diabetes as well. So these are the according to the STEP survey 2014, and 94% of adults live with at least one person. So these are the. Unfortunately, we cannot get the up-to-date data for the whole national data because we do have every 4 years the STEP survey 2014 we did and 2014 and 2019 we plan to do that, but unfortunately because of the COVID-19 we cannot do that. So now this year and we'll do the STEP survey again, so we can get the up-to-date data. So bear me for that. The data are the old ones, 2014. So you have to project, and that data might be 10 years. So according to next slide, please. Next slide. So according to the 2014 data, so you can see that at that time, diabetes is 10.5%. This is the age between the 25 to 65. So with that data, that there might be 2.5 million of diabetes in the Myanmar. So we did the OGTT, so we can know the percentage of the pre-diabetes at that time. So pre-diabetes is 90.7%, and there are around about 5 million people in the pre-diabetes people in the Myanmar. So that 5 million people will be in next 5 years time, 35% or 1/3 will be going to the diabetes. So you can foresee that now it is 10 years now. So it might be a more number now. So hypertension at the time is 26.4%. Cholesterol is 36.7%. I means 1 in 3 patients has a raised cholesterol. Obesity is 5.5%. Overweight is 22.4%. Smoking is 26.1%. So the problem is smokeless tobacco. We have a beta nitrogen 43.2%. You can see that how much the big problem, right? And then the current smoking is around about 19.8%. and heavy drinking 10.3%. These are the data from 2014. Now it's 10 years now, so you can see more than the number may be more increasing I'm expecting. Next slide, please. So because of that, 26.4% adult has a high blood pressure. This is 1 in 4. 10.5% has diabetes, 1 in 10. 36.7% has a raised cholesterol, is a 1 in 3. So altogether, there might be a big problem with the cardiovascular death. So because of the nature is the underlying cause are unhealthy diet, smoking, alcohol drinking, pediatric chewing, and the young childhood obesity are we can see a lot of problem with the young childhood obesity, and physical inactivity are underlying cause of these problems. Next, please. So this is the 2016 data of the morbidity and the mortality, and then 6 out of 10 that are due to the NCDs. You can see in that data. Next, please. So Myanmar is So our target is in 2020 that we have to going down all the cardiovascular disease to less than 25%. We have to going down. That's our target. But that target might not be unlikely to meet that target for reducing premature mortality from NCD unless urgent prioritized action will be implemented. This is estimated by the WHO. We cannot get these targets because in 2020, we have to bring down the premature mortality of the cardiovascular to up to 25%. We cannot meet that data now. Next slide, please. So you can look at that in the region, the percentage of the total death due to NCD is, top of the list is the Myanmar. But, expenditure GDP for using for the health expenditure, the less is Myanmar. So you can see that data. The cause of deaths are big one is Myanmar, and the health expenditure very less in Myanmar. This is the big problem in Myanmar at the moment because cause of deaths are very high and the health expenditure very less. So these are the big problem now we are facing in the Myanmar now. And we are fighting, when we fight the NCD, this is the big problem now. Next, please. So the country capacity for NCD, we have an NCD department. We have a national policy and plan for NCD. Yes, we have. We have a policy, we have some dedicated budget, but there is a very limited budget. Most of the budget is going to communicable diseases. We have cancer registry. We have a service every 4 years. We have some program for prevention and health promotion, but this is very less. And we have some PEN project. We are now, because of the, we are now doing some PEN project is going go for the rural health area. Everyone say we're now opening NCD clinic in the rural area. So at that area, at the age of the 40, above 40, we go for the screening of the diabetes, hypertension, and we screen diabetes and hypertension free. And if we saw the diabetes and hypertension, we give the free treatment at the moment that the government is doing at the moment. But this is an opportunistic screening. We cannot go for door-to-door things like that at the moment. So we have now around about 7,000 rural clinic, but because of the now situation of the political instability, and then because of the COVID situation, then around about 4,000 are functioning, but we are still doing at the moment for this kind of thing at the moment. And then we have some management of respiratory disease, and to bring down the risk factor. But this is, we need to do with the collaboration with the other ministry. So this is the weak point at the moment for the fighting with the NCD. Next slide, please. So this is the roadmap we need. So we need some leadership, law enforcement. Next. So we need the coordination mechanisms. Next. We need to strengthen the health system. Next. We need a capacity building. Next. Risk factor reduction activities. Next. New tobacco law. Next. Legislation. Next. And advocacy. Next. And health promotion. Next. So these are the things we need to do, but these are some constraints. There's a limited access to NCD care for the poor and rural population, mostly high out-of-pocket expenditure at the moment. I would like to say around about 70% at the moment, high out-of-pocket expenditure at the moment, including diabetes care. We do have a good primary healthcare system, but limited service and infrastructure for NCD at the moment, mainly go for communicable diseases. Integrate implementation of good policy and plan to address NCD, just like tobacco control. We cannot control too much at the moment. Limited funding for NCD program, and then limited donor interest to the NCD as well. So thank you so much to the FOD and for the helping the type 1 diabetes at the moment. And our Ministry of Health also helping the type 1 as well, but not much really at the moment, because they are mainly the focusing on the type 2 diabetes at the moment. So for me is for help personnel, very much thank you very much for the A4D for the helping type 1 patient in the Myanmar. Next. So summary, NCD are #1 killer in Myanmar. More than half of the NCD deaths are premature. We have a preventable risks that are highly prevalent, may further increase due to liberalization of trade and marketing. National response to NCD being intensified, cost-effective approach needed to increase access to the NCD service. Next, please. But, at the moment, our Ministry of Health are doing like that. We have a double problem, and we are now fighting communicate disease. At the same time, we have a problem with facing the NCD burden as well, with the diabetes. So thank you very much for your kind attention. Thank you.
Thank you, Professor Coco. Thank you for this talk. It was really factual and really interesting to know, and we can see that there is a lot of gap that still needs to be filled. But thank you so much for your impact and commitment to this. So next, I will invite Professor Mitnila. So we will now focus more on type 1 diabetes, and actually Professor Mitnila is another great supporter of Action for Diabetes, and I'm very honored today because it's personally my first time that I am welcoming her as a speaker, and we are extremely grateful to have you tonight with us to share about type 1 diabetes in Myanmar, Professor Mitnila. So I will stop sharing and I will share your deck, which is here. Here. So Professor Mitnila, the floor is yours. I hope you see your slide. Yeah.
Thank you, AC. Can you hear me?
Yes.
Can you hear me? Okay. I was very honored to be invited as a presenter, and thank you, A4D, for giving me a chance to present this section. Next, please. Yeah. As for pediatrician, I like to express some barriers in the management of type 1 diabetes. So everybody knows what is type 1 diabetes. According to WHO, and this is the type 1 diabetes is a chronic condition, and a pancreas can produce little or no insulin. And the other said that it is a type 1 diabetes is due to destruction of beta cells in pancreas due to autoimmune process. So the islet cell can produce no insulin or extremely low insulin. Next. And, sorry, I can't see this right side. Okay. So the global prevalence is approximately 1.1 million children under the age of 20 living with a type 1 diabetes. And according to the ISPAD in 2018, 96,000 children have the type 1 diabetes. So the annual incidence is type 1 is 98,000 annually under the age of 15 years. So the trend is increasing, and globally about the 3 to 4% annually, and they can diagnose between the age of 4 and 14 years, and the peak incidence is around the 10 to 14 years. Next, please. In Europe, they have a higher incidence of type 1 diabetes, especially in Finland. and they have 60 per 100,000 children per year. But in North America, in the United States, reporting that the 20 per 100,000 children per years. In Asia, compared to Europe, they have a lower incidence, but in countries like India and China, they have a higher number of cases, maybe due to the large population. In Africa, they have a less number of the patients in Africa. Next, please. So in type 1 diabetes in Myanmar, according to MSEM and CDIC report in June 2024, total number reached up to 532 patients. So we are taking care of diabetes with and our NGO or international organizations like FOD and CDIC are collaborate with MSEM, and they are supporting the type 1 diabetes under the umbrella of MOH. Next, please. I like to highlight some challenges in managing the type 1 diabetes. And next, please. The late diagnosis is common, and they came up with a complication like a DKA, and public awareness is also lower in globally. The same problem is in Myanmar here, and the awareness is lower, increase in the healthcare professional and the general public. Next, please. And the economic burden. The cost of managing type 1 diabetes is higher, especially without the adequate health insurance and government support. In Myanmar, the same problem, and they have according to this economic burden, this lead to irregular monitoring, inconsistent medication use, and reduced adherence to necessary treatment. Next, please. And what about healthcare workforce? Healthcare workforce varies worldwide, especially in rural area. The shortage of the specialized diabetes care facility and healthcare personnel. So the same is here in Myanmar, and we have a shortage of endocrinologists and diabetes educator. And what about the healthcare access? People in rural area have to travel long to have their healthcare facility. So this can delay the diagnosis and treatment. Next, please. So there is a disparity between the urban and rural area. An urban area like Naypyidaw, Yangon, and Mandalay have better healthcare facilities, including hospitals and clinics, so they can provide the specialized diabetes care. However, in a rural area, these are lack resources, and this make it difficult for patients to receive the adequate care. And the specialized centers in our country has a limited number. Next, please. Everybody knows that insulin is essential for care of the type 1 diabetes, and we can say it's a life-saving medication. But the availability and affordability is quite challenging in our country, because insulin availability can be inconsistent, and especially in the rural area compared to urban area, because the urban areas, they have the hospitals and clinic, and they can supply more insulin than the rural area. Next, please. And so cultural and social factors can affect the management of diabetes. In Myanmar, we have cultural beliefs and misconceptions. People think that they have the diabetes because they have a lot of sweetened food and drinks. So when they have the diabetes, they avoid the sweeteners and sweet food, and they have to take more bitter food and sour food. So this misconception, because they don't understand the etiology of diabetes, so this will lead to the unhealthy lifestyle. Next, please. And this socioeconomic disparity can lead to burden for access to healthcare and cost of treatment. And next, please. And we have a higher complication rate and a higher mortality, and this will affect their health outcome. Next, please. From the patient's aspect, this impact their quality of life. Not only children with type 1 diabetes, but also their family have the experience of significant impact on their daily lives, like daily regular blood glucose monitoring, insulin administration, and dietary management, and psychological burden. So the comprehensive care is essential for the support of their type 1 diabetes. Next. Yeah, we did some foresight initiative for the government and NGO program or international organizations. We have a next, please. We have international organizations like FOD and CDIC collaborate with the MSEM. And for the education awareness campaign, in recent years, I was working in Mandalay, and I did a HCP training in a big city of the Upper Myanmar. As far as I remember, I did a HCP training with adult endocrinologists in Nichina, Moyua, and Tangji. And I did a diabetes camp for type 1 children in Mandalay. And for the technological improvement, and we use a telemedicine for care of type 1 patients since the COVID era, and still using a telemedicine for patients living in a remote area. So the development of the Hello Type 1 education program will be very useful for type 1 diabetes care, especially in this situation. Next. It is said that type 1 patients need to find the balance. If they can find it, they can have a successful, so the balancing of medication and stick to daily routines and a medication and nutrition plan. Whenever the journey of the type 1 diabetes, they have the right tools and support and can do anything. These are the some support group mentioned by the ADA. Next, please. These are the steps for the successful journey, and education, educate yourself and stay organized, seek support, work with your healthcare team, and maintain your healthy lifestyle and stay positive. Next, please. So these are future direction and recommendation, and policy recommendation is important because I need to emphasize for better healthcare infrastructure and robust policy and funding to support their diabetes care, and for community involvement. We need to strengthen the community and family support, and need for programs that engage the community and supporting individuals with type 1. And for research and development, need to do more research. So, next. This is last slide, and area for improvement is training for healthcare provider and improve access to medication and supplies, and development of comprehensive care, and enhance patient education and support, and overall strengthen government policy and funding. Next, please. Thank you for kind attention and joining this section.
Thank you so much, Professor Metnila. I think it was the perfect introduction to Endo Type 1 program, to be honest, because you mentioned all the key areas, like you even mentioned as well, fighting stigma, that is really one of our priority. So before actually sharing the rest and actually sharing about Endo Type 1, I would like first to ask if there is any question from the audience for our guest speaker, Professor May, Professor Coco, and Professor Miller, because I know Professor May has other commitments and she will have to leave before the end of this session. So if anyone has a question, you can raise your hand, unmute yourself, ask, or you can also type in the chat if you want. Anyone has a comment or something?
Excuse me.
Yes.
AC, nice to meet you, and thank you so much for the amazing presentation, Prof. Nila and Prof. Coco. I'm sorry that I can't share video because there is no electricity at home right now, so I can only I can only speak on the mic. And I would like to ask a question to Prof. Nila. During your journey as a healthcare profession on type 1 diabetes, what is the most challenging when it comes to the treatment of the T1Ds? And if a child is diagnosed as T1D, what are the very first steps we should do to engage?
Professor Nila, you're muted.
Yeah. So you mean in first come to clinic, what is the important task to do, right?
Yes.
Oh yeah, it's as I said before, and they stick to the proper management, like stick to the insulin regime and lifestyle changes and diet. And these three things are important. So that we have to check whether they are having the regular dose, correct dose of insulin and at the right time and the right amount, and they are changes their lifestyle. It means that are they doing the regular exercises 30 minutes per day, and what about their dietary habit, and yeah, and the important one is a regular follow-up. Is that okay for you?
Yes. Thank you. Thank you very much.
Maybe, hi, Prof. Mindala, it's Charles Toomey here. Just to follow on that question,
Okay.
I just wondered, I imagine that one of the other challenges you get is the parents themselves being very unsure about the situation. So, I mean, I understood your answer in terms of practically this is what needs to happen, but what are the types of questions that the parents are asking you in those early days when they find out they have one of their kids has got type 1?
When they know that their child has a type 1 diabetes, their concern goes to hypoglycemia. So whenever they want to give their child insulin, they're worried about having hypoglycemia. So when we introduce insulin, we have to educate them repeatedly. So we educate them what is hypo, what is hyper. So my patients know what is hypo and hyper, and our home management for hypo and hyper. So we give them a chart showing what is hypo and what is hyper, and after that, they are familiar with that attack and they can overcome it.
And the good thing is that within Endo Type 1, you will have dedicated section on hyper videos, poster, just to remind everyone. So I hope this program will help you all in your day-to-day clinic job.
Yeah, just to jump in.
Yeah.
And can I just say, AC, Professor Mintnila, just so you know, we're going to do a big piece on exercise and how to really break it down so people do it, because we all say, yeah, 30 minutes a day. Very few people do that because they're worried. They're worried about hypos or about hypos. But there's plenty of ways to introduce it and to break down those obstacles. And it's generally accepted now, certainly in the West, that exercise is one of the main ways of controlling blood sugar, 100%. And so yeah, we'll help you with that. And we'll help you to help your clinicians and your young people so they really do embrace and do regular exercise, and they will see meaningful improvements for sure. But yeah, that's work in progress. But we're definitely going to be delivering that.
I have one question. Is that okay? Obviously, thank you so much, Prof. Mintnila and Prof. Coco. To both of you, do you think that the Hello Type 1 launch following today, that there will be easy access for the population with type 1 diabetes to get onto the website platforms or the Facebook platforms? They are in the native languages, but do you think that there will be issues, as you say, with data, the expense on accessing it electronically? Obviously, we look to you and all the professionals here to let the families and the young people with type 1 diabetes know about Hello Type 1. All our information on hypos are ISPAD quality accredited. They are very easy language, but my question is, do you think that there will be issues with people accessing it?
One thing is, so for the big city, it is not a big problem. In some area, there might be a cutout of the internet, and there might be a less access to the internet. There might be in that area, there might be a big problem. But still, we can be, reach out to these people, right? But say some remote area, because of the instability of the situation, there might be some big problem. But we'll try to reach out to these people as much as we can. So one thing. And here is people are not very much used to with the website, right? They are not very much logged into the website. Even mostly the educated parents and then some educated students, right? They are not very much familiar with the website. They are more favorite to the Facebook, I think, right? So our social media is very much familiar with the Facebook. Usually go to the Facebook, and they are very much used to the TikTok, right? Here is that they are the two very much famous social media platform here. So that now in the Facebook are some limitation. Now we have a blockage of the Facebook and the VPN. We need to overcome the BPM, using the BPM, something like that. So we still have a struggling, but we have a number of the 532 Taiwan patient now. So we will try to reach out each and every one to get that program. So we'll follow up them.
Thanks so much, Prof. Coco. I think that's very useful information for us. We have the same information that goes through our Facebook as well. And there's a question from Daniel. What is the most challenging for patients and caretakers who are of low literacy? I think that is a difficult question to answer. And some of our information on hypos, and basic education is not of high literacy. Some of them are animated, but it still requires some level of literacy, isn't it? So it'll be interesting to see. And we look forward to, obviously, Sonini's PhD results in 2 years. He's finished his first year on how it impacts Southeast Asia. So thank you so much to both of you. I just have to leave in 10 minutes, but I really want to thank Prof. Nila, Prof. Coco, and everyone who's attended today. And of course, AC for organizing the whole thing. Thanks.
Thank you so much, Professor May. And
Thanks from me.
thank you for this.
Thank you.
Thank you for this discussion, because it's the perfect way for me to show you now what is LO type 1 and how it can help you, and answer all the questions actually you might already have. So I will go back to the presentation. Voila, to open the correct one. So now it's my part. So my name is Anne-Charlotte. I'm a French pharmacist, and now I'm specialized in giving information about type 1 diabetes to young people, and I'm working for A4D for I would say 4 years now, and I am the one who fully created LO type 1, and I am very proud of it. And today it's very symbolic for me to launch it in Myanmar. It was really like something that was really close to our hearts, because we know that this program is extremely needed in Myanmar. And it was a journey, because it was not that easy to adapt in local language, and we wanted to make sure that everything was accurate and following all the guidelines. So thank you for those who really helped me. Thank you to MSEM. Thank you to Dr. May and Dr. Ted and Dr. Toon. I don't know if he's on the call here, but he really helped. So I'm really proud today to show you this program. But first, actually, our co-founder Jerry Gore told me, like, AC, don't forget that we are patient-centric, and LO type 1 is about people living with type 1. And he is so right. He reminds me what is the core of this program. So we contacted 2 patients, and right now I would like to share a message from Yati, who is living with type 1 since 2015, and Wai Young On, who is living since 2019. So now I will share their message to you. Let me make sure the sound is working properly.
Anh nghe được đọc phải chứ, chúng ta có đồng đây từ là tập phải. Và cả đại phải diabetes của thằng ta thì nó đã trong sáng ai ạ tập phải. Những cái chỉ là rồi nó thì là một website này Facebook mà thì hay quan lên bật đặt rồi anh em thông tin chụp tại lúc hôm nay thì ai anh em nó sẽ nếu thì thế có qua cái công sự tại lại của nó đâu có phải thì là thì for Tanzania thì là nó có được hơn một và nó đâu có ra rồi but all of you seem to do it in energy the one that one my feeling as well what some was like the for example Italian plan tại của nó rất tinh nhiên từ này dài ta sử dụng để có cả phụ tiêu chí sẽ bỏ thì là của nó từ của nó thì ra cả trang sẽ ra từ về ra giảm khổ thì sẽ có tiền ở thực
My name is Wei Yao. I have been living with type 1 diabetes since 2019. It is important for me to have access to Facebook and website because of the reason: community support, information and education, practical trip, updates on research, and emotional support. It is important to join communities of other people living with type 1 diabetes because they give me mental strength. I can see I am not alone and I can learn from others. I am happy to have Hello type 1 and I am sure I have a beautiful life even I have living with type 1 diabetes.
All right, then let's move forward, because I can see the time, it's already passing. All right. So What is Hello Type 1 mission? So the mission of the Hello Type 1 is to give access to unlimited and accurate information about type 1 diabetes in Burmese. Hello Type 1 has been designed to inform and support everyone who have their life affected by T1D, if they are living with diabetes or caring for someone with diabetes. The program aims to educate, engage, and empower. Hello Type 1 provides fundamental T1D information in clear and engaging formats, helping both patients and caregivers to improve their understanding of the condition. Hello Type 1 brings the T1D community together on social media, fostering a positive and interactive environment for people with T1D to use their own experiences to help each other to overcome their challenges. Hello Type 1 shares inspiring local stories that resonate with T1Ds, focusing on overcoming struggles and combating the stigma. And Hello Type 1 supports also HCPs and offers tailor-made webinar and workshops on T1D fundamentals and promote also cross-country collaboration to strengthen healthcare capacity in the region. So, Hello Type 1 ecosystem, because it's not only a website and it's not only Facebook, but both are really important. And Professor Coco is so right. And I know, I'm really aware that in Myanmar, like Facebook is everything and people are using Facebook as a website, like we will do in other countries as website. So Hello Type 1 is an ecosystem made of one website, hellotype1.com/mm, like Myanmar, which is the resource center. It's where we host the content, basically. And the Facebook page at Hello Type 1 Myanmar is for the community engagement. And we will have also regularly some offline events to provide psychosocial support. So the idea for Myanmar is to create the Facebook page in Myanmar a bit like a mini site, to make sure that all the relevant information from the website are shared on the Facebook page. Like these people can really see and have access to the type of content it is, because I know that they will not navigate by themselves on the website. So this is really important that on the Facebook page, we also put the content there. So the website has been created for 3 types of audience. So the caregiver, the people living with type 1, the caregivers, and the HCPs. The Facebook page is focusing on supporting T1Ds and their families by engaging and empowering them. And we are sharing also all the content, as I mentioned, like patient stories. And in the next step, I would like to open TikTok. And this is really something that I would like to do. So Hello Type 1 is a free tool, so that is very important to mention. That is totally free, and there is no registration, nothing to access it. So Hello Type 1 content is curated from the topics using information only taken from accredited sources, such as IDF or ISPAD. This content is reviewed and adapted by a panel consisting of healthcare experts, endocrinologists, nutritionists, diabetes nurse, psychologists, and members also of the Southeast Asian T1D communities, helping to ensure the information is appropriate in a local context. For each topic, you will find some articles, but also posters, quiz, and videos. Videos are very simple animation that basically summarize the whole topic with the key information. For the posters, same, it's a summary for each topic, adapted on mobile phone, so on mobile format. And in Cambodia, we have adapted it in a book, in a booklet. So this is something that we can definitely do for Myanmar in order to access patients who have trouble to access internet. At least they have the basic information on hand. So the content has been designed also for you as HCP. to use it as tool to educate your patients. So you can use also the videos during workshops, or if you have, I don't know, a TV in your waiting area, this is something you can use. All the posters can be downloaded and printed, distributed to your patients. The content available is in constant evolution. More categories are coming. And it's, for example, like we want to do a category on job employment, for example, how to share to your employer or your colleagues that you have type 1. So we will produce new content on a quarterly basis, but it's asking a lot of resource and ideas. So that's why, like at the beginning, we focused on the fundamentals and then we expanded. So that's why now we have content about school, how to succeed in university, this type of thing. So voila. So we have three categories of topic. We have the basics, really T1D basics, essential information for actively managing and understanding T1D. So you see, you can find blood glucose monitoring, insulin, nutrition, hyper, really the basics. Then we have life with T1D, with tips and insights for living fully and thriving with T1D. It's where we have content about school, about also mental health, stories. So we have also, like, for example, lifestyle, like consuming alcohol with type 1 diabetes, this type of content. And then the last one is for caregivers. So it's really essential information and support for those caring for T1D. For example, I fear my child has type 1. My child has just been diagnosed. How to help the communication with the teacher of your child, how to talk to them, how to empower a child and make him independent and not over controlling, for example, this type of topic. Then, as Professor Mint-Nila explained, it's really important that we also work on the psychosocial support. So, as explained previously, we are focusing on engagement and empowerment of the T1D community, which is not easy, I have to say. But we are trying to be here to help them to overcome their struggles and stigma and encourage them to have the best life they can have. Having the support of their healthcare professional and having the best insulin regimen in place is the most important, but there is also the stigma and struggles they are living at home. And it's where Allo Type 1 can also make a difference in understanding and supporting them. So we are trying to build a community across the country where people can share about their lives and help each other. But as a first step, we offer a dedicated article related to mental health, emotional well-being. And we are sharing also T1D stories on the Facebook page. And we will organize very soon also like T1D online patient workshop through live streaming on the Facebook page. I know that it's not as efficient as if we are doing face-to-face, but that's a first step and it's easier to organize. So it could be like how we start a more like organized peer-to-peer support. And we aim after to have more like face-to-face events, maybe in Yangon, in Mandalay, in Tangier, big cities. But it's a lot of resource for our coordinators to organize. So that's a little bit the presentation, but now I want to show you how it works. So this is Allo Type 1. So as you know, we have two things. So this is the Facebook page that we have launched like a month and a half ago. So you will find different posts and topics. So here it has been really created for Myanmar, like summaries, how to manage things. But we will also start posting from the websites. So the Facebook page is really important, as we mentioned, and we will build up on it to make it like a kind of a mini site with, for example, the video as playlist that they can access easily. So this is the page that all your patients can just follow and like. We will try to publish at least 2 times per week on it to make sure like there is regular content updated all the time that people can follow. And here is the website. So hello type 1. So when you enter the website, this is the home page, and this is the way you navigate, because all the content is on the home page. We didn't want people to navigate too much. So first, because we are patient-centric, people-centric, at the beginning you have stories, and you can access directly to the stories. And we aim to have also those stories in video with interviews. There will be also Facebook posts. So this is the first thing when you enter the website. And when you browse, like it's here that you have the 3 categories of topics. So the basics, life with T1D, and for caregivers. And so you see, you can just click on the tab, and under you have the subcategory that we have mentioned. And here you have all the resources. So all the list of articles, videos, and posters. And below you can follow the Facebook page. It may link to the Facebook page. And we have really proud to put the MSEM logo here. But for example, if I show you, if you choose insulin category, you will have only the insulin resources available. You see, we have 3 videos, 1 poster, 2 articles. If you click on the article, so you have the text, and it's where you need a good literacy. And I know that some people, they don't like to read articles. So that's why for each article, you will find, almost each article, you will find a video like this. And I'll show the soundbook.
Insulin soda, vale.
Voilà, for each big topic, you have little animation like this. That is normally very easy to understand. And it's free to access. It's on YouTube as well. It's on the website. I can send you also a copy if you want to pass it in your clinic. So we have those little video on I would say we have 13 videos. And also for each, we have also this poster. How would we use? So the poster is adapted for mobile. So when you open on desktop, it's not the greatest because it's really, we try to fit it on the screen. And it's where you have this little summary for each category created like this. So the main information that you really need on hand. This is actually those posters that we have adapted in book in Cambodia. And this is a project I would like to do in Myanmar also in the next coming months to adapt those posters into a book that you can give to your patients that don't have access, enough access to internet. So I wanted to show you also, if I, on the article, okay. At the bottom of some article, like the basic article, like the key articles, you will find a little quiz. So I know that people are not, they are not really fond of quiz, but it's a good way. It could be even a game that you can share with your patients. Actually, we use also sometimes those quiz for the nurses to know if they know their basic of T1D. And so the person will answer the question. I cannot read per me, so I cannot let you know. But at the end, when you finish your quiz, basically the website will tell you where you were right or wrong. And so we have those quiz for mostly all the basic category, like hypo, hyper, complications, nutrition, what is carbs, and everything. So I found it a good tool if you want to test the knowledge of someone. It's simple but efficient. Also, you will see on each article you will find the different sources. We have also a disclaimer at the bottom of each article because to remind that we are not healthcare professional, we are not a clinic, we are like offering a service of providing information, but it's important to always remind people about that. And I just want to show you also that we have also like a category for healthcare professional where you can find the publication that May has mentioned. So you can read it directly on the website. You can download it also below. And we have the webinars. We have some old webinars that we did, but you have also, for example, the talk of Professor May that she gave dedicated in actually a year ago. She did the first talk for online training in Myanmar. So you can watch it again. You just need to click it and it's available here. You have the summary of the talk and everything is free and easy to access. So globally, this is the website. On About Us, you will find some information on how the program has been created, the people who are endorsing and supporting us, and you have also like all the key healthcare professionals that has been supporting us. And you have the profile of everyone, so everything is very transparent, I would say. So that's for the live demonstration, and if I can just show you, if I go back to my presentation, the live demonstration we just did. Yeah, so basically we have created some promotional material. So it's really important to emphasize that this program will never exist without your support, because we need you to share it to the patients. So it's really a collaboration, like a cooperation all together. So we have built this program to facilitate the access to information, but it's with your endorsement and your help to relay the information to your patient that the program can succeed. So you can share with your patients and the family. We have designed a flyer that we can distribute and send to your clinic to be available for your patients. You can have a little stand inside your consultation room with the flyers, and during their next visit, your patient can scan the QR code. It will land on the website. They can also open their Facebook app and search for Hello Type 1 Myanmar and follow our page. And of course, if you have any suggestion how to promote the program, we are very happy to discuss more. And I will just show you little mock-ups. So we have actually the flyer, we can print it in A3 posters. If you want to hang it in your clinic, we can print also A5. And we will print also a little QR code on a sticker that you can distribute to your patients that can stick it to, for example, their blood glucose diary, for example. So we will send you a form in the next coming 2 weeks to ask for your feedback about this meeting, but also to know what is your need in terms of those promotional material. So for example, if at that clinic you need 10 posters and 50 flyers, we are happy to organize that. And yeah, let's discuss. I'm really happy that I've been able to show you. So now, do you have any comments, maybe? I have been able to open all the chat, so thank you for your kind word, Professor Moore.
Hi, AC.
Yes.
Can you hear me?
Yes, I can. Hi, how are you?
Yeah, I'm okay. And then sorry that I'm enter a bit quite late because of the connection problem in my home. So that's why
I
I keep
understand.
silent. And then that Hello Type 1 launch is really, really very, very, very brilliant work of you. And then, you know, that's very beautiful for the pictures and everything. I think our type 1 diabetes patients, children, as well as the families, they have a good benefit from using this. So we really appreciate it. And then definitely we will share with our patients and families to have a look on it, and then they can make use best of it. So thank you for everyone. AC, May, Professor Minang, Fiona, Charles, and then you know, that the other one, Jerry, as well. So nice to meet you all.
Well, thank you for your kind words. You know, it's really, really nice to hear, because it's not easy to build a program like this, but it's really with your kind support and your encouragement and with your support that we really have been able to do that. So I really hope it can make a difference for the life of the young people, because I know you're so busy, and I hope that this program can help you, that at least you can provide a tool that they can at home, like check and learn to understand better the condition. So yeah, I really, really hope that it will be useful for the T1D community in Myanmar. Thank you, Professor Mo, for the words.
AC, let me just say a couple of things from the patient perspective. I think sometimes it's kind of hard to understand how can a website really help in this challenge of living with a very complex condition that's all about your brain and how you feel and your emotions, and it's minute by minute, day by day. There's no rest breaks from it. I think for me, the best way to explain it is let's take fear. Most patients, most carers are frightened. Let's be honest. They're frightened. There's a condition they don't understand. Something's happening to their bodies. Something happened to their children, and they're frightened. And they're frightened all the time. You can't break fear down very quickly and very simply, and you break it down bit by bit, and there's lots of ways of breaking it down. This website, Hello Type 1, is definitely an aid of helping people break down the fear about this complex condition, because it's positive. There's lots of images, there's lots of ways of assuming or assimilating information. Some people take in information by reading, some people take it in by listening, some people take it in by looking and watching videos. And this offers a way of dealing with the real complex conditions and situations, and helps break down that fear. And so to me, a website like Hello Type 1, from the patient's point of view, is a bridge between the theory of dealing with this complex condition and the practice of living with it every minute of every hour of every day. And I just wanted to add that. So maybe there's some healthcare professionals here who's saying, well, you know, is it useful? How can I use it? Does it help our patients? Anything that's giving them information in a way that they can accept it is a good thing. And anything that's breaking down that fear is really, really positive and useful. And I really believe that this website does that. So I just wanted to offer that, really.
Thank you, Jerry. No, but that's so true. Yeah. Professor Coco, you wanted to say
one thing, Ceci. So when we started with the program, it should be a dynamic, right? So we need to keep updating, right? And then do you have any plans and for the some interview with the say supposing interview with the Taiwan patient or interview with the Taiwan patient parents? So they're talking about peer review or Taiwan the interview with the experts about the how to overcome the problem or something like that. So there might be a very useful one because we can hear their difficulties and then we can share their difficulties. And because we are talking about the theory, theory, and then we are sharing the theory, but we don't know their difficulties, right? Sometimes we do need some of their difficulties, and some difficulty might be they related to the logistic problem. That might be we can solve by ourselves, but there's some problem might be related to the theory. So I say supposing what can I eat or how can I inject or how can I bring. So this might be a good idea for that one. Or sometimes we do a podcast for the for 5 minutes talk and then send to the finds. Right? We cannot go for interview, just go for some some children are very talented, so they do for the podcast and send their find to you, and then you listen, and then you put on your Facebook or the things, so you can hear their voice. So this kind of thing, do you have any idea to do that or something like that?
That's a very good idea. Thank you for that. For the podcast thing, because it's true that it's challenging. Actually, it's where you can help me because we have access to T1D, but we have currently, I think we have 3-4 in Myanmar that are happy and to share their story, their picture, to do videos and everything, but sometimes it's difficult to convince people. So if you see someone in your clinic, a parent or a T1D that is very excited about the program, like you can put them in contact with Dr. May and Dr. Ted. Dr. Ted is in Mandalay, Dr. May is in Yangon, and they will be the link. But it's exactly what we want to do because right now, LO type 1 is a bit LO type 1 that we have in the region. But now it's time to be focused on Myanmar, so I need to understand better also the situation. As you just mentioned, maybe it's insulin storage, for example, how to keep my insulin. So that's a very, very good point. I started to do analysis country by country, and I realized that in some countries, the top topic is foot complication. And they really know to understand how to take better care of the feet, for example. So it's by interviewing that we can understand better. And yes, definitely. In Cambodia, we are pretty advanced because it's the first country we have launched. And for example, the diabetes camp that we organize with FOD, it's a very good occasion that the LO type 1 is there, the team also when we talk, and we record video, messages, we do, I don't know, like cooking, we are cooking something. So diabetes camp is a really, really good opportunity for us to sit and talk to parents, to young people. So yeah, definitely, it's the way we want to do. But I love this podcast idea. Thank you. It's a very good idea because sometimes it's not easy for people to go on camera. And as you mentioned, for example, I give you an example, the message from Yati. The poor girl didn't record it for 4 days because of heavy rain. So the noise was so bad that she couldn't record herself. And sometimes it's not easy to go full on camera. So this podcast idea, it's a very good idea. So thank you for that. And it's really where all of you can help us. Just when you know someone that might be interesting to talk to us, you just put this person in relationship with May and or Dr. Ted in Mandalay now, and they would be super happy to go and meet them. Any final comments? by talking about that, actually, my last slide is here. Like, so we have a big, actually, shout out, a big thank you to Dr. May Ted Lin, our dear FOD coordinator for few years based in Yangon. And prior to Dr. Ted, we have Dr. Tun. I don't know if he's in the call. We miss him very much. He's in Bangkok now. But now Dr. Ted Kokoo is replacing him in Mandalay. So we have 2 full-time dedicated FOD doctor coordinator, so they can be there on field to support any initiative. So you can always revert to us with ideas, suggestion, anything. And we will contact you in the next couple 2 weeks with some feedback. So don't hesitate. If you want to tell us something, you can just revert on the email we will send.
Can I make one suggestion?
Sure.
Actually, you know, we doctors are very busy in our own clinic, seeing with the patients and talking and everything. So what I would like to do in our type 1 clinic, as Dr. May comes every week. What I would like, what we can do is either she might she can make a one comment or one video or one short talk about that, you know, this is the Hello Type 1, how to use it and then how to make it, you know. Otherwise she needs to explain every time for that the children. So in the clinic, what we can do is before that Hello Type 1, she can make a one saying in Burmese, like this is the website and to use by the type 1, and then how can they use it, how can click it, and what information they can use it from the, you know, in Burmese language. So that would be easier. And then what we can do is she can show them because patients come to our clinic after seeing with us, they always make a contact with Dr. May to get that insulin and everything, you know. So in that case, she can show from her like an iPad or book, you know, phone or something like that. She can show how to use it. But it's a bit difficult to explain everyone one by one.
So no, that's true.
So that's why she and Dr. Takoko should make either one and can make one short presentation before that, and then they can switch on that video file, and then, you know, so every time. Maybe what we can do is in our clinic, we have a video on the, you know, on the board, so we can show up, you know.
That would be amazing.
So it should be more useful and more helpful for our patients, you know. But it's up to them if they don't mind explaining everyone about how to use it and how to, because sometimes our Burmese people are a little bit not of the poor literacy. Sometimes it's very tricky to make them understand, you know. So so that's my suggestion.
It's a very good idea also. I'm sure Dr. May will be happy to do it. Dr. May, are you on the line?
Yeah.
For sure you are.
Yeah, yes, sure. Yes, you are, AC. Yes.
Yeah, actually, like so that means the patients are coming the same day, the T1Ds are going to the same day to the clinic? They are coming on the same day?
They are coming every week, one day and to us, and then one day to UM2, and then I think I'm not sure about in Mandalay, but whatever, they can make a link. They can, Dr. May can show that the link, or, you know, but anyway, whenever they come to the clinic, just for introduction, you know, she has to say and introduce that Hello Type 1 website. But you know, despite of talking every time, she should just show up and then open the video link, and that would be more easier for her.
No, for sure, but actually that's very good to know, because it's a good opportunity also in Cambodia. That was the case also. All the T1Ds were coming every week, and then they started to do regular like little workshops in the waiting area with the T1Ds. Like one week it was about blood glucose monitoring. They were watching the video, asking their question. The week after it was about insulin. So actually it's very good for us to know that they're coming the same day, because we can organize more small events like this. So thank you for that. Yeah, that would be great. Dr. Ted, you said something in Mandalay?
Yeah, I was just telling that it was a very nice idea, and thank you very much, Mamo, for the great advice. And I just got an idea that whenever we meet a new person with a diagnosed with T1D, we should also arrange in the website, like there is a starter package. Like when you are just diagnosed, there will be a starter package. You gotta complete the course and you gotta ask questions before we make any inputs. We should arrange a starter package like that.
Yeah, in the UK, for example, they get even like a little gift at the beginning when they are diagnosed. They have the whole little package with the teddy bear, the JDRF teddy bear, this type of thing. So this is something that we have to think how we can work, but definitely that's a very good idea. And it could be motivating also for the families that have been diagnosed, that at least they know there is some support somewhere. So it's okay. We can discuss about it. Thank you so much for all those very great ideas. I really appreciate. Anyone? Because I guess it's pretty late for you, so I don't want to keep you too long. So if anyone, if no one has another comments or closing remarks, I think we can close the event. So yeah, thank you so much. I was very, very, very happy. It was a very important moment for us at F4D to finally put Myanmar on the map. So don't hesitate all the time to come back to us. A big thank you again to all of you, to MSEM, to have this very strong partnership. It's very important to us, and we are very, very proud to put your logo on the posters and all the materials, because you are like, thank you for your work and your support. And yeah, so I will send a recording of this video. So if you know people who might be interested, they didn't know, they can just share the link as I do usually with our webinar session. And yeah, so I wish everyone a very, very nice evening and a very good weekend. Thank you so much for your attention.
Thank you, everyone. Thank you
for everything.
Bye.
Yeah. Thank you.
Bye.
Yeah.
Bye-bye.
Bye-bye. Thank you, AC.
Bye, everybody.
Bye-bye.
Thank you. Take
Thank
care.
you so much.
Bye-bye. Thank you.
Bye.
Bye-bye.